Hi everyone, welcome back to the 209 podcast. You may have noticed we took a brief hiatus, but we figured that there was no better time to return than right now in the midst of the COVID-19 pandemic to keep you guys informed. This podcast features a remote episode where we traveled to UC Merced to speak to two of their experts, Dr. Juris Grasis and Dr. Howell, and they shared some insight about this infectious disease, what you can expect from it. It was a very insightful conversation. We learned ways to protect ourselves, and really we wanted to separate fact from fiction, get rid of any conspiracies you may have heard, and just deliver the facts about this to you guys so that you can stay informed and safe. So without further ado, here's the conversation, and thank you for tuning in to the 209 podcast. Dr. Grasis, Dr. Howell, thank you so much for joining us on the 209 podcast. Obviously, we have a pandemic right now that's sweeping the country. There are a lot of nerves out there, uncertainty. So we just wanted to speak to some experts who could lend some insight into the topic. I was wondering if you guys could just introduce yourself and your area of expertise and how it relates to the coronavirus.
Okay, my name's Dr. Juris Grasis. I am an expert in virology and the immune response to viruses. And so this outbreak fits right in line with what my lab studies.
And I'm actually a health psychologist, so I study health decision-making and behavior, and I have a particular expertise in how people deal with uncertainty. So I'm kind of on the other side. I'm on the more how are humans responding side of this.
Yeah, now this respiratory disease, we've heard it called many names. We've heard coronavirus, we've heard COVID-19, some people call it the Rona. So I was wondering if you guys could just talk about, the proper name for it and what this disease really is and how it is attacking people's bodies.
Okay, so the proper name for it is SARS coronavirus 2. It's related to the original SARS coronavirus outbreak in the early 2000s, and so this is a very similar type of viral strain to that. COVID-19 is related to the disease itself and how the disease might affect a person and progress from there.
Yeah, and there are some misconceptions that I wanted to talk about right off the bat and kind of get out of the way. A lot of people are saying this is no different than the common flu. Could you speak to that?
I could, yes. Sorry, I always look at you. I mean, it is relatable to the flu in that that's what we know, but this seems to be a lot more dangerous. I mean, we have a vaccine to the flu every season, and yet it still infects up to 60 million Americans every year. It may actually kill another 60,000 Americans every year, and we have no vaccine to this, right? So it could be much scarier. A lot more people could become infected, and a lot more people could actually die from this disease. So it's similar because that's what our knowledge is to the flu, but it is actually much more dangerous because we have no vaccine to it.
Yeah, and is there any psychology behind that of people, just telling themselves that this is just a flu, I don't need to worry about it?
Yeah, absolutely. So I think that a lot of people, so we kind of have a psychological infrastructure that protects us in the case that we're facing bad news or uncertainty, that essentially is there to help us think good things are going to happen and be optimistic about the future, because otherwise we would give up, right? And so it's pretty natural for people to, first of all, make analogies. That's pretty natural, but also to try to understand it in terms of what they've encountered before. And I think that it is psychologically, it is actually very different. And so having to stay home and be in a different place actually really kind of shifts us away from our typical flu symptoms, where maybe just the people who are sick would stay home. Now we need this kind of on a broader scale. And so I think that it's shifting psychologically and emotionally for a lot of people, but at the same time, I think it's starting to feel psychologically different, particularly as our measures are ramping up.
Yeah, and those measures are ramping up. Over the weekend, we saw Governor Gavin Newsom call for California residents 65 and over to self-isolate. He called for bars, restaurants to close, either do curbside pickup. We still see a lot of younger people out and about because they seem to think that this is an illness that only affects older people. Is this the case?
Actually, I mean, this virus in particular does seem to affect a lot of older people, but not exclusively. It is affecting people of all ages. It just seems to affect people with compromised immune systems, metabolic disorders. So the elderly tend to fit into those sort of categories where they have our immune systems actually start to slow down as we age. They might have more metabolic disorders, but people who have hypertension or diabetes are more susceptible to this as well. So it really could affect everybody. And so optimistically, if you're healthy, you should be okay, but there are still some mitigating circumstances.
Well, and it's also the case that the symptoms don't necessarily present right away. And so I think people don't realize how many immunocompromised people they come in contact with. And also the things that they do socially that immunocompromise them as well. So like drinking it compromises your immune system, right, in some ways. And so I think people don't necessarily realize the kinds of behaviors that they're engaging in, how they can put other people at risk. And yeah, even if you're healthy, I think that, we have to take those measures to protect our broader community.
Yeah, those protections. Oh, sorry, did you want to add
Well, think about other parts of things that could affect you. I mean, let's say you actually do get the flu. I mean, that's an opportunity for this virus to actually come in and infect you and take over and be even more dangerous than the flu. So there are circumstances that would make things even worse for you, even as a healthy young adult.
Yeah, and during this pandemic, we have I don't know if it's a benefit or if it's actually hindering things, but we have social media and people have a lot of reaction to things. A lot of people are saying that these closures are just, too much. Is it really necessary? Is it really necessary?
I'll let you feel this first.
Actually, I think we've lost time. I think it's, scientists were aware of this virus in December. We started sounding the alarm in January. I think government started to take notice of this in February, and only lately have we actually started to make any sort of adjustments to this. And there isn't enough testing, there isn't enough going on. I don't think there's an overreaction. If anything, this is an underreaction and everything's much too late. Unfortunately, what that often is going to lead to is things that we're seeing in other countries where we're going to be on total lockdown perhaps soon. And that's where things get scary.
I mean, and kind of returning to that social media point, I think that you do have a situation where information is being transmitted. Social media can be really powerful in this time because as social beings, as humans need social interaction, and we need diverse social interaction. In fact, it's actually good for our immune systems. It's healthy for us to interact with other people. And so social media can be really great for keeping in touch with people, just like FaceTime or Skype, Zoom, etc. Those things can be really good for us. And I think people have, for example, been hilarious. So laughter is actually very good for you. And there have been hilarious tweets and things of the sort. But it's a double-edged sword because we are getting some of that misinformation coming out. And people essentially through social media setting a norm that it's not that big of a deal. I think norms are shifting, and when that happens, I think people are going to start taking it a little more seriously. But in the meantime, I think we should use social connection through the internet to connect to one another, but really have to kind of be conscious and beware of the kinds of things we're reading and double checking sources. There was a case in South Korea where a church, they went around spraying salt water in people's mouths because they found on social media something that said it prevents the coronavirus. Well, it turns out it infected everyone because they were all together using the same bottle. And so, I think that it's really important for people to think critically about the kinds of information they're encountering on the internet. Ask the question, who's really behind that source? And are they motivated in some way? And then also to remember that we really want to feel better about this. And so our psychological immune system essentially is going to make us want to believe we're not at risk. And so sometimes you have to double check those expectations. When something seems too good to be true, it probably is.
Yeah.
So, and I think about what Mr. Rogers always said, in time of emergency, look for the helpers, right? And so look to the health professionals, look towards your doctor, look towards scientists, and these are people who are actually trying to help society as a whole and get the right information out. So look for that sort of information.
Yeah, speaking of, the right information, there's a lot of information out there on how people can protect themselves from this virus. We see wash your hands. There's some conflicting information about face masks. I've even, seen just it's airborne, people are saying. So How can people protect themselves? What are the best ways? What are the best equipment that they can use to protect themselves?
Yeah, so this is a respiratory virus. I mean, so it is transmitted through the air and through aerosol contact. So the best way to actually kill the virus is simply by soap and water, right? It really is true. People might not think that something so simple could work so well, but basically the virus is held together by fat, by lipids. So if you use soap, if you put soap into your dishes, all the fat disappears. Well, it's the same thing that happens with viruses. So if you go and wash your hands, the virus will break apart. So that's one of the best ways to go about getting rid of the virus. The hand sanitizers work equally well. So if you don't have soap and water, do use the hand sanitizers. Then otherwise, we talk about social distancing. I mean, keep outside of 6 feet from someone else, because that's the amount of distance that an aerosol can actually spray. And then in context of bigger social gatherings, it's important to actually stay outside of or in groups of less than 10, so that your chances of interacting with somebody who might be infected is much less.
Yeah, what kind of impact can that have on people right now, social distancing? We're social creatures.
Yeah, I actually think it's a problematic term in many ways. We really are talking here about physical distancing. And I think that some people are taking that to mean I need to be socially isolated. And they don't necessarily think creatively about how can I still get that social interaction. And it's hard to be lonely. It's hard to stay in the same physical place, particularly for some people. But it's the case that even introverts need social interaction. And so there are some people who are, in the Bay Area, for example, right now, who are sheltering in place alone. And that can be really, really hard on a person, not just from a psychological perspective, but it actually does appear to compromise the immune system from the evidence that we have. And so it's really a positive thing to try to connect with other people. To do things like get online and cook dinner together with someone from your family, or call up someone. We have a lot of extra time now. It's a good time to reconnect with people, and it's a good time to make sure that even if we're physically distancing, we're not actually socially totally cutting ourselves off, because I think that's a really tough thing and something that will undermine people's ability to kind of make it through this, particularly if it lasts a long time.
So if I also could get back to your question about the face masks, and I don't mean to discourage people from wearing a face mask necessarily, but it's not, in most cases, it's not going to protect you from getting the virus. You would have to have a face mask that properly fits and conforms to your face, and it has to be of a filter that actually could filter out viruses. And so those sort of face masks are kind of rare. Where face masks are actually quite useful is if you do have a cough, if you do feel like you're sick, you can actually keep the aerosols within you by wearing a face mask. So it's good at preventing the transmission, but unfortunately not as good for preventing getting the virus itself.
Yeah, and I think there has been a lot of confusion about that, but if you're sick, a mask can help. If you're not, wash your hands a lot,
right. Pretty
much.
Exactly.
Now, what is the difference between this flu, the coronavirus, and say the swine flu or the avian flu?
So first of all, those are two forms of flu. So actually this virus itself is very much similar to the SARS outbreak and the MERS outbreak. Those are all coronavirus outbreaks. Where it is similar is that the number of people that are becoming infected. So during the swine flu and the avian flu, there were a lot of people who were becoming infected. The big difference, however, is that very few people died from those infections, whereas the percentage of people that are actually dying from this outbreak, it seems to be about 20 to 30 times worse, right? So there is a big difference in this infection.
Right, because I think a lot of people say, well, look at all of the people that were infected with like H1N1, and we didn't take quite the measures that we're taking now. It's that mortality rate.
Right. Yeah, and affecting health overall of anybody. Because I actually told my students that if you ever have the flu, you know it, right? If you say that you had the flu and you're like, oh, it wasn't so bad, well, you didn't have the flu. If you have the flu, you're in bed for 5 days. And so this is, even worse. You could be in bed for 5 to 10 days, and it really does affect how you feel for a long time. So yeah, you don't want it.
Yeah. Now, is this comparable at all to the Spanish flu of 1918? Could it reach those epic proportions where we're seeing millions die?
It is very similar to that. I think what made the 1918 flu such a big deal was the fact that all these people were traveling all around the world due to World War I. So a lot of people were becoming infected, and a lot of people of healthy age were being infected. In this case, we're having the same sort of global transmission due to people traveling all around the world. So it's been spread really quickly initially. So yeah, we have this. Could be as big a pandemic as that. And I don't mean to be alarmist, but I think it's prudent to actually treat it as such.
Yeah, and the best example we have to go off of right now is Italy, who's about 10 to 11 days ahead of us in this pandemic. Do you think that we will end up seeing, that many cases here in America, or did our leaders, intervene soon enough, in your opinion?
This is all you.
Okay. I don't think we have. I think we're on that path, unfortunately. I think we're on that way to total lockdown, and the same sort of number of infections and number of cases going to the hospital to be about the same of what's going on in Europe. So it's scary, and I think we just lost our opportunity to quarantine people, test and quarantine people early.
Yeah, Dr. Howell, why are people not seeing what's going on in Italy and taking this more seriously?
I actually think we're seeing two sets of reaction. I think there are some people who are taking it very, very seriously, and actually for whom it's presenting issues. So uncertainty causes us to worry. Worry is a normal human reaction. It makes us take steps to fight against the bad things that could come our way. And so, but when worry can't do its job, when worry is impeded from actually allowing us to do more than, for example, wash our hands and not quite know, did I come into contact with someone who's at risk, or who has this virus, am I now at risk? I think that can actually create some really undesirable consequences. And now that people are staying home alone too, I think we have some maybe psychological problems that are emerging, things like symptoms of anxiety and depression, loneliness. We see this in data from people who are quarantined, that you do see kind of increases in these types of symptomology. It's not great. But at the other side, you have this group of people who are not taking this seriously at all. And I think that for some of them, I think it's just because they don't perceive themselves to be at risk. A lot of data in the health psychology literature suggests that perceiving yourself at high risk is important for you to take steps. If you don't think that you're susceptible, then you're not going to do anything to change your health behavior. And so I think we need to extend people's perception of susceptibility to think more than just about themselves, but to think about the people in their community and the people who they might be impacting by interacting with them. And I also think that it's important for people to realize that the numbers that we have on this thing are a little bit wonky because people are being tested at different rates. It is the case that a lot of the younger people are just staying home, and that's what people are recommending to do. I think, correct me if I'm wrong. And so it could be the case that our susceptibility rates are wrong in some ways, and that people are not taking it seriously enough. And so I think that it's really, as you mentioned, we're not doing enough testing. And so I think it's really important for people to realize that, regardless of kind of what side of that spectrum you're on, or if you're somewhere in the middle, that this is something to take seriously. It's something that we need to take action to fight as a group, which is difficult. Collective action is difficult, but at the same time, we need to kind of prevent ourselves from going into that state of panic, because that could be really bad for our mental well-being, which is in turn pretty bad for our physical well-being, especially things like sleep disruption. So sleep disruption it just hurts your immune function almost immediately, and worry is very associated with this. So people who are sort of anxious about this need to find some outlets. Anxiety, mindfulness meditation is a really good one. Accepting the fact that you're anxious and then trying to kind of move on from there, I think is really important, because otherwise you're up all night worried about, your elderly parents or about your kids, and that can kind of undermine the ability of someone to survive, especially for a long time, without experiencing anxiety, depression, etc.
Yeah, you mentioned 3 things there that I wanted to follow up on. As far as anxiety and depression, what can people do while their county or their city is in lockdown to ensure that they're keeping their mental health healthy?
Yeah, so I mentioned before mindfulness meditation. So the idea of mindfulness meditation is kind of about living in the moment. And this has actually been adopted by therapeutic practice in kind of the clinical psychology literature. The idea is that you kind of sit in the moment and you allow yourself to recognize the thoughts and feelings that you're having, and then accept them. Just sort of say, like, I'm having these, and that's okay. And I think that can be really helpful. There's also some good guided meditation videos online and things like that. A second thing people should do is try to keep their minds active. I have a colleague of mine, Kyla Rankin, down at the University of California, Riverside, does some research looking at flow and how it helps people deal with uncertainty. And so flow states are the activities we engage in that really challenge us and where we kind of get so involved that we lose time, that we forget about kind of what's going on in the world around us. So something like doing puzzles or trying out, a new cooking technique or making art or writing, things that can really engage you and engage your mind will help to reduce worry and therefore help to reduce some of that anxiety. And then finally, I think we just have to continue to interact socially without physically interacting. I think that it's important to continue to reach out to one another because that is such a huge part of our psychological immune system is the other people in our world.
Yeah. Can people go outside? Can you go for a walk when you're on lockdown?
I would recommend it.
Yeah.
Yeah, I mean, go out and get fresh air, go out and get some sunshine. Just try to keep, some distance away from others that you might encounter and get outside. I mean, actually, that's what took down the flu of 1918 is that people were recommending to go spend time outside. And UV exposure is good for your immune system. It's actually good to break down the virus as well. So just getting some fresh air, it is a good thing.
And nature makes you happier. It's being cooped up in your house can be very stressful. Also, especially if you're with people, family can be tough sometimes. And so sometimes it's nice to just get out and be able to kind of think for yourself and breathe in, have fresh air. It's good for your happiness as well as it is for your health.
Yeah. One of the things people keep mentioning is that, this will, die off in the summer when it gets warmer. Is there any fact behind that?
I don't think there's any information about that so far. So I think it's too early to tell.
It's kind of wishful thinking, maybe.
It would be wishful thinking. I would be hopeful thinking. But I think that this is going to be something that's going to stay with us for a while.
Yeah, and of course, one of the main concerns with this virus is that there is no vaccine. Why with this particular strain of coronavirus is a vaccine taking so long, and when can people expect one?
Okay, I mean, vaccines actually take a really long time to make, and there's actually a lot of viruses that we don't have a vaccine to. We know about HIV for 40 years, and we still don't have a vaccine to that, and we only have a treatment. It is difficult and tedious. It does take a lot of time to test out vaccines and determine their safety and their efficacy. So, I mean, even in the most optimistic way of thinking about it, it could take us 12 to 18 months to even develop the vaccine. And then you got to think about another 12 to 18 months to even ramp up the supply enough so that all Americans can get it. So it is a difficult period. So we shouldn't really expect a vaccine anytime soon, unfortunately.
Yeah. Here in America, it almost seems to some people that this happened overnight. I think it became real for a lot of people when the NBA season was canceled last Wednesday. Is this accurate? Did this pandemic happen overnight?
I mean, scientists first were aware of this in December, and then it became very alarming in January. It does, I understand the feeling, and it does feel like everything changes really quickly. I mean, I was supposed to be in Vegas this weekend, watching the March Madness, so it does change rapidly, and I agree that once the NBA canceled, things became very real. But yeah, it hasn't happened overnight. We've been aware of this for some time, and we've kind of missed the opportunity to test. So I think we need to take that opportunity now and test as much as we can to anybody who wants it.
Did you want to add something?
Yeah, so I mean, I think at the same time that it didn't happen overnight, I was in Asia actually at the time when the outbreak first, when it was kind of outbreaking in Wuhan, and I remember people there were taking it very seriously. And then I came back and, I went to a conference and gathered in big groups, and there had, even after cases came, I think that despite the fact that it didn't happen overnight, physically, I think it did psychologically for a lot of people. Like, I think people are kind of reckoning with a new world, and it's something that's going to probably be with us, as you mentioned, for a while. And so it's going to take some time to settle into that. It's going to take some time for people to figure out what a routine looks like, and how they can make themselves kind of excited to live their day when they aren't necessarily going and being able to gossip over the coffee pot at work. And so I think that we are kind of in this emerging phase in a lot of ways with emerging restrictions. People are very curious. I mean, lots of news outlets are doing stories about this right now precisely because it's, despite the fact that it didn't come physically overnight, it did psychologically.
Yeah, and
That's a good point.
I think a question a lot of people have is, why are people hoarding toilet paper? Like, why is the panic buying? Shelves are empty, people are lining up, there's lines wrapping around Costco's around the nation. Why?
I know. It seems so strange on its face. But it's very, sort of very normal reaction. So again, I think when people feel uncertainty, they feel worry. And worry is a cognition emotion blend that makes us want to do something. It's an experience that makes us want to prevent bad things from happening. And we are in a place where we can't necessarily do that and be sure that we've prevented something. And so people are just trying to find any action they can, whether that's refreshing the news every 5 minutes and trying to stay up to date so they know exactly what's going on with the science right now, or going out and hoarding toilet paper. I think that they want to be prepared, and they want to be able to, if we can't mitigate risk, maybe we can mitigate the consequences of it. So if I do end up stuck in my house for 2 weeks, will I have enough toilet paper? Yeah. And the second thing that's going on is scarcity. So humans react to scarcity. I mean, this happens every Christmas. I remember the Tickle Me Elmo phenomenon, and every year there's a toy that you can only get in a scarce quantity, and everybody wants it. And humans just we have an inherent value associated with scarcity. And so when we know other people are buying up toilet paper, we want to go do it ourselves. So it's kind of the pair of both of those things.
Yeah, and that being said, I think this is a question that probably both of you could lend your expertise on. Do you think people right now are more frightened of, the virus and catching the virus, or the social and economic impacts of, everything closing down? And which do you think they should be more afraid of?
Well, I can understand that people are afraid of both. But as a virologist, as a scientist, I think we should be very alarmed by this virus because people are getting infected, their health is being impacted, and people are dying. So that right there is very impactful and as much so as the economy.
Yeah, and I think not just from an economic but a social perspective, I do think that some people are very much concerned about what is my life going to look like. I think there are a lot of people who are very concerned about how am I going to pay my bills. I think that that's a very real thing for a lot of people. They're not necessarily worried about getting sick, but they're worried about how they're going to kind of survive in an environment where they can't go out. And so I think that it is the case that there are some people who are really, really focused on the virus and on their susceptibility. People who are older, have heart conditions. You see a lot of those sorts of folks really being very cautious. And then you see a lot of younger people who are like, why don't I get to go? I don't get to have my graduation, or I don't get to have my wedding, or there are these other things that it's interfering with. And I think that it's not necessarily that they're scared of that, but that they feel a sense of loss. And that sense of loss is making them want to perceive themselves less at risk. Like, maybe it's okay if I still do this. Maybe it's okay if I still travel to wonderful places or hang out with my friends, because maybe I'm not at risk. Yeah.
But they still could run into their grandparents or other people who are at risk. So it's something that
I mean, we're all going to the grocery store, right? Like
Yeah.
it's still the case that we're still interacting with immunocompromised people in everyday life, and people do need to do that still. Because of stockpiling, some people are having to go to multiple grocery stores. A friend of mine has a 72-year-old mom in the Bay Area, and she went to 8 grocery stores the other day before her daughter eventually reached out to everyone she knew in the Bay Area and said, "Does anyone have toilet paper? My mom is out, and she's gone to 8 grocery stores." It's a problem. I mean, I think that. And so she encountered all those people who were also there trying to hoard things. And if they just felt sort of resilient to this, but were carrying it, it could have been really dangerous for her.
Yeah.
Well, and remember too, this is a respiratory virus. So if you're going to hoard anything, facial tissue would be the way to go.
Yeah, it's not a stomach flu, right?
Right.
I don't know why all the toilet paper is
I
necessary.
still don't know.
We really are responding to this in a way that we respond to disasters, right? So the kinds of things that people are doing, it looks like hurricane or earthquake preparedness, right? I want a bunch of water, even though there's nothing wrong with our water right now. And, I'm going to have some toilet paper. I need the essentials so that I can hunker down. I called my mom the other day, and we were talking about this, and she said, I looked outside today and I just thought, it's so sunny, there can't be anything wrong, right? That we're just so used to natural disasters being something that's kind of physically happening in our world. And so that's how people know how to prepare. So they're just doing the thing they know how to do.
Yeah, no, of course, these are unprecedented times for everyone, especially here in the Valley. It's a more rural area. Do you think that has played a part in why we aren't seeing the lockdowns here? We're less populated. Are we less at risk than, say, the Bay Area?
I think we're equally at risk. I think what happens in the bigger cities is that you might be around someone who has actually been exposed, who's been infected, so you might take it more seriously. But I think people here are taking it just as seriously. I mean, you go to any one of the shops and the markets, and people are taking it seriously.
Yeah, I mean, I do think that we have had a delay in some of our responses as an area. I mean, even at the University of California, Merced, we responded. We were kind of one of the last to move online out of the UC system. In part, that was because we are on a semester system and they're all on quarters, so they were done. It posed a really interesting challenge for people here. But aside from that, I think that people here do actually perceive themselves less at risk because you do have like more physical space. You can look out and see 4 miles, and so you're like, well, I feel distanced. But we are living in density here, and so I think that it's important for people to realize that we're not, that San Francisco is not somehow really, really, really different than us, and that we are still all going to the same couple of grocery stores, and that we're still interacting with one another.
Once we start hearing of confirmed cases, and once we know somebody that is infected, then I think people will also take it much more seriously around here. Yeah,
well, it looks like we're on the way to taking it seriously. Stores are closing. We're here at your guys' campus. That's pretty much empty. It's unprecedented times, like I said, and I want to thank you guys for taking the time to talk to the 209 podcast and kind of calm maybe some of those fears or anxieties of the people watching. In closing, I was just wondering if you guys wanted to share some advice or encouragement to the residents of the Central Valley.
Just to echo something I said earlier, as far as finding your information, go to the helpers, go to the health professionals, go to the doctors, go to the scientists, look to those people for information, and that will be the best way to go forward.
And for me, I would say, don't physically distance, but don't socially distance. Try to maintain social connections, try to maintain a routine, and keep your mind active and engaged, because it's going to be really hard to, especially as we enact restrictions on where people can move physically. It's going to be hard for us psychologically, and I think we have to prepare for that. And doing things that are going to allow us to get through that, I think, are really important. So, yeah.
Yeah, awesome. Well, thank you guys so much for joining us. If you're watching and you want more information on the coronavirus, the best place to get information that is true and accurate is the Center for Disease Control website. So thank you guys so much.
Thank you.
Thank you for having us.
That's the episode of 209 Podcast.